Welcome back to Therani, I'm Joe B. Today I'll show you how to improve limited ankle dorsiflexion from a tibiofibular joint dysfunction. Let's dive in. What are the signs and symptoms of distal tibiofibular anterior joint dysfunction? Your patient complains of foot dragging during walking. Patient also feels that the lateral malleolus is more anterior than the other foot, also confirmed by palpation. There's also a limited ankle dorsiflexion range of motion. The causes of this dysfunction include a previous recurrent history of an untreated ankle sprain. Normally, during ankle dorsiflexion, there is an anterior glide of the proximal tibiofibular joint while the distal tibiofibular joint posteriorly glides. But after a recurrent plantar flexion and inversion mechanism of injury of an ankle sprain, the ligaments can pull the lateral malleolus forward and inferiorly, resulting to a distal tibiofibular joint anteriorly gliding and a proximal tibiofibular joint posteriorly gliding. In order to determine if your patient really has a distal anterior tibiofibular joint dysfunction, we need to assess the proximal tibiofibular joint first. The position of the patient will be in a supine position with the tested knee flexed 45 degrees, feet flat on the floor. The therapist will be standing on the tested side. Right hand stabilizes the distal leg while the left hand lateral forefingers will be at the posterior tibiofibular joint, just inferior to the posterior fibular head. From there, the therapist checks how much gliding is available anteriorly at the proximal tibiofibular joint. If the gliding on the right proximal tibiofibular joint anteriorly is more limited than the left-hand side, then that is one piece of the puzzle. To assess the last piece of the puzzle, which is the distal tibiofibular joint presence of a posterior glide, then the position of the patient here will be in supine, the tested foot at the edge of the table, the therapist on the right anterior thigh utilizing that to stabilize the patient's right foot. The right hand now will stabilize the leg, while the left hand will check for an adequate gliding of the distal tibiofibular joint posteriorly. Then we'll compare it to the opposite side. If the opposite side is better than the right side, then that will be the second piece of the puzzle. And your patient will require two types of mobilization techniques. One would be a posterior gliding of the distal tibiofibular joint, while the other one will be anterior gliding of the proximal tibiofibular joint. Now let us go to the treatment. The good news about being able to know how to test this joints for dysfunction is that the same position for the testing is the same position for the treatment. So the patient will be supine, knees 45 degrees flexed, feet flat on the floor. And from this particular position, again, the therapist will be at the foot of the patient. Right hand to stabilize the leg, left hand to pull the tibiofibular joint anteriorly. Hold that for 30 seconds and do that for 3 reps. For the distal tibiofibular joint, the position of the patient would still be in supine, right foot, treated foot at the edge of the table. Therapist will be on that side with the right thigh stabilizing the patient's right foot, the right hand of the therapist stabilizing the patient's leg, and the left hand will deliver the posteriorly and superiorly directed force gliding the distal tibiofibular joint to that backward direction. The position is held for 3 times of 30 seconds each. For exercise prescription, you can provide your patient with supine, seated, or standing ankle dorsiflexion that can be performed for 10 to 20 reps. You can also perform stretching of the calf muscles, particularly your gastrocnemius muscle, with the knees extended at the edge of the steps. The position is held for 30 seconds, done for 3 reps. You can also give your patient a soleus stretch at the end of the steps with the knees flexed and is done for 30 seconds hold for 3 reps. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.